This is an interesting story because it's very inside baseball and relates to something I talked about before. But there was one bill that passed unanimously out of the House and the Senate that was not HB 1013, but it was another health policy bill. This is Bill HB 1324, and it has to do with coverage for emergency medical care for patients that insurance companies would often dodge, because if a patient went in, let's say for crushing chest pain, I think I might be having a heart attack, let me go get worked up, that they would go into the ER, they would work them up, and maybe thankfully it wasn't chest pain, it wasn't a heart attack, and they get sent home. That the insurance company would look at the chart, flip to the final page of the diagnosis and be like, oh, it wasn't a heart attack. You should have known better. You shouldn't have gone to the ER. Therefore, we're not going to pay for any of it.
What?
So we all understand that that is, first of all, unethical. First of all, ridiculous, because how could a patient possibly know what they have? Even physicians in the ER don't know what a patient's having until they do the workup. That's why you do the workup. And that's exactly what we tell patients to do if they're worried about life or limb or function, to come in and get checked out, right? So this was a bill that I had actually dropped last session in the form of SB 82, exact same bill, same issue. Got through the Senate, got all the way up through House rules, and then it got pulled for political reasons. And this year, we were told that we really like this policy. This is good health policy, but we don't want your name on it. We don't want a Democrat on it. We want to give it to a Republican, preferably a Republican woman. So that's what happened.
Whoa.
And it's one of those things that I think that we just need to, make it clear that this stuff happens. I'm not the only person it happens to. This happens all the time, right? So I'm not unusual in any way. There's nothing special about this bill. It's just This is the stuff that happens, that you see good policy. You're like, this is good. We're going to use this so we can run on it and give it to someone who we want to help. Which is fine. Which is fine. I mean, obviously there's the reaction immediately because it's like someone kidnapping your kid and being like, now we're going to send it to let this person have your kid. But the goal, I think, and what we have to remember is that the goal is for the policy to pass because it's going to help people. And it doesn't matter, it's hard to say, but it doesn't matter who's on it, and it doesn't matter like what happens along the way. The goal is for it to pass. So anyway, it passed through the House, it passed through the Senate, and I was very grateful that when it got back to the Senate, actually at every step along the way, everyone knew this was my bill because it was it was known that this was my bill. So at every step along the way, every committee process, people were like, isn't this Michelle's bill? And when it got to the Senate, that the Lieutenant Governor's office actually let me preside over the passage of that bill. So I at the rostrum and bang the gavel and count the votes and everything like that. So that was a very nice gesture for them, because I think they understood that, like, that's kind of shitty that happened, but we want you to be able to,
You can connect with us on all major social media platforms at Confused Caucus. Please be sure to like, follow, and share.